Hi, Caroline.
Hi, Mariam. Hi, everyone. Welcome to our Instagram Live. We are Glasgow Women's Aid. We provide information, support, and temporary accommodation for women, children, and young people experiencing domestic abuse. We've come on today as part of our online campaign, Still in Lockdown Week, which is essentially a week-long campaign to raise awareness and increase understanding of domestic abuse. When Scotland went into lockdown, we noticed a significant increase in donations, support, media attention from the public. But as we leave lockdown, this attention is fading, but the problem still remains. So I'm Caroline, I'm the training and development worker for Glasgow Women's Aid. And this week, through the campaign, we're highlighting partner services and organisations. And today we're being joined by Mariam, who is the co-CEO of Amina. So they're an organisation based in Glasgow, Edinburgh and Dundee, and their services support and campaign for Muslim, Black and minority ethnic women. Mariam is also one of the Scottish Women's Aid directors, and she has a wealth of knowledge and experience supporting women and violence against women and girls, specialising in the support of migrant women and Muslim, Black and minority ethnic women. So hi Mariam, thank you so much for joining us.
Thank you so
You're our first
much today.
takeover. So this week we are raising awareness and increasing the understanding of domestic abuse. And you obviously have so much experience within this field. What are some of the main points that you would like to highlight today, Mariam?
I think when lockdown, before lockdown hit, you've said that so the work that I do, I've worked predominantly, and in Amina, we work with Muslim women and Black and minoritized communities, women from Black and minoritized communities. So a lot of BME women, and if you look at the kind of situations that they were in, even before lockdown, you'll see that a lot of the women that we supported already had barriers to support, discrimination, Islamophobia, misogyny, everything that was going on, harmful traditional practices, and then lockdown starts, and what we found was that those existing inequalities had just doubled. So it's kind of one of those things where you thought, okay, how do we deal with lockdown? How long is lockdown going to be? So I think initially I remember me being quite naive with lockdown, thinking, oh, this will be done in 2 or 3 months. And here we are, how many months later? But the longer as time has gone on with this lockdown, the more inequalities have become greater.
Yeah,
The inequalities that were already there, they become greater. But the
yeah,
Amy women, the impact on services, the impact on providing those services, and so many months on, we're still in lockdown. And this is why I think this campaign is so important. We're talking about still in lockdown. We're saying, look, yeah, as much as, we're talking about Freedom Day and etc., is it really Freedom Day? And
yeah.
when Freedom Day does hit, or restrictions ease, what does that look like for women after so many months in lockdown? Where are they when it comes to support? Has their situation got better? Because I would say it's probably got worse. You've been staying
Yeah.
for so long. So those are the kind of things that I think we want to kind of highlight when it comes to lockdown and domestic abuse.
Brilliant. So you were talking about barriers. What are the main barriers that women are facing trying to leave the relationship, an abusive relationship? What would the main barriers be about for them trying to leave?
So anyone who's watching this, if you think about coercively controlling behavior, for example, right? If you're being controlled and all your movements are being controlled, and you're living with the perpetrator, and you're being told, look, where are you going? Who are you speaking to? Why are you doing this? Why are you doing that? And what we would find was that maybe women could try and get out, come to a women's aid office, come to the AMNA office or whatever. But when lockdown hit, it was, well, where are you going to go? So you had all those slogans everywhere that said, stay safe at home. So really
Yeah,
what we're saying was that your home is your safety, so you can't go anywhere but stay at home. But
yeah,
how were women going to feel when home was not safe? Now, additionally, we were talking about Black and minoritized communities, and the women that we support, there was already language barriers there. So typical services that they would have accessed were closed down. Everyone was working from home. The perpetrator was home. They were home. The kids were home. Where were the excuses to leave home, even for minutes, to seek support or make a phone call? We know that a lot of families started walking, but I think a lot of women, when they were walking, the kids were with them, the husband was with them.
Yeah.
And where was everyone's outings during lockdown? Lidl, Asda, Sainsbury's, the only place
Mhm.
available. So
Yeah.
really, to be
Yeah.
honest, if your home was not your safety, and you already have all those barriers, then what kind of situation were we in? And I just remember lockdown starting, Caroline, and even before lockdown, I was doing a lot of work around coercive control. And I remember saying to everyone, look, the first thing that a perpetrator will do if they want to control you, and that is to control your movements, right? But how hard is the perpetrator having to work now under lockdown?
Yeah. Yeah.
Where are you going to go? So it was a case of women were at home with the abuser, or still at home with the abuser 24/7. And a lot of the routes that they would use to come to Glasgow Women's Aid or come to any project, it kind of just shut down. So,
Yeah.
and the barriers that are there were already there. So, immigration, for example, where to go for services, who to speak to.
Mhm.
Um, we know that BME women and women in general, they'll go to the school, they'll go to the nursery,
Yeah.
midwives appointments, health visitors. Those were always like the kind of community organisations that you always felt were right in there, but even they were kind of working from home, so
Yeah.
it didn't help.
So Mariam, we as a community and for service providers, what support can we give women then that are experiencing abuse and still struggling to leave, still to being isolated? What kind of support as a community and service providers give to the women?
Do you know, Caroline, it's quite interesting because I think during lockdown, a lot of, for example, community organisations really had to step up, right? Because it was one of those things where community organisations were like, okay, who needs this? And food parcels and digital or whatever. But when we're kind of looking at what kind of support we need to give to women, we need to kind of go back and look at where are we right now. If we're
Yeah.
locked in and we're coming out of lockdown, you've got women who might have wanted to leave at the beginning of lockdown but still haven't felt that support and that need to do so. Immigration issues, as we want, and I really want to touch on this, Caroline, is if you're thinking about a lot of asylum seekers, the asylum system has just gone downhill. When it comes to support, the Home Office have not given women that level of space and that support that was needed. One thing that I would say that was quite interesting during lockdown was when the first lockdown happened. My first concern was that if you're specifically talking about BME communities and women from BME communities, especially women who have immigration control, what's going to happen to them, right? Because what normally happens is it's kind of pass the parcel kind of thing, right? Unfortunately, women's aid groups can't take them on because of funding issues, right? So we can only support women in women's aid groups that have recourse to public funds, or we can take a limited amount with no recourse to public funds, but we couldn't take every single case
Yeah.
with recourse
Yeah.
to funds.
Absolutely.
So there's a limit with every single women's aid groups. So what would typically happen is that women seeking support would then go to the homeless casework teams, and normally the homeless casework teams might say no, thank you.
Yeah.
Public funds, we can't do that, especially if you're a single woman with no children. So if you
Yeah.
had a kind of way to seek safety, but if you didn't have children, the single women who were fleeing domestic abuse were pretty much on their own. Now,
Yeah.
first lockdown, what happened? Automatically, the local councils gave the women hotels to stay in. Now, the hotels are not perfect, but that was a much better step up response than what we had seen before. Okay,
Yeah.
what we had seen before, Caroline, was no thank you, we cannot support these women. They need to claim asylum or go somewhere else. But now what was happening was an automatic, right, we're going to have to put this woman in a hotel because we can't see her homeless and
Mm-hmm.
a complete strict lockdown. But that
Yeah.
didn't happen before, right? So before it was like, oh, right, okay, what do you do? So
Yeah.
that was the one thing that I would say did get better during lockdown. But
Yeah.
as far as I know now, evictions are now going to start back up.
Yeah.
And
Yeah.
are we still going to see that same response from local councils? Now, the Equally Safe policy and, Scottish governments, we've got this really, really good policy, and it was done with COSLA about supporting women with no recourse to public funds. And
Yeah.
one of the things that it quite interestingly said was that women with no recourse to public funds should be housed by their local authority. Now, your local authority in each locality works so differently. So
Yeah.
one of the biggest things would be, Caroline, there's not enough women's aids. Refugees, right? We want women's aid, I think, provide such a vital service to women that sometimes you just wish that you had more refuge spaces, like per
Yeah.
population. Again, that would be a
Absolutely.
big wish list, and you would want that. But
Mm-hmm.
when women don't have, or women's aid is full and there's not capacity, where else do you go? And it's local
Yeah.
authorities, in my opinion, that need to step up when it comes to women fleeing. And it's not a case of what's your visa. So we've got
Yeah.
a
Yeah.
support system at the moment. So
Yeah.
women who are born in the UK, who don't have any immigration, have a almost not a clear line of support, but you know where it can go. But if you don't have immigration, it's kind of like you're way below,
Yeah.
right?
Yeah.
Already causes complications because if you are an asylum seeker, for example, you are vulnerable, you're still experiencing the same kind of domestic abuse. Interestingly enough, I used to work in a predominantly South Asian area, and I know that in Amina we support a lot of BME women. But as much as I've supported BME women, I've also supported women who are not from BME communities. And
Yeah.
down the issues are the same. It's still the same tactics. Perpetrators will use the exact same tactics. It's not any different because
Yeah.
they're men from BME communities. So really, women's experiences of domestic abuse are the exact same. The only thing
Yeah.
I'm thinking about is that there's a different pathway to support at times.
Yeah.
So the other thing that you'll find with BME women is that they might not realise that actually, especially if they're not born in the UK, that they are allowed that support. And it's unbelievable, Caroline, but it's still kind of used that, well, if you call the police on me, or if you tell anyone I'm British, you're not,
Yeah.
workers will give the kids to me and not to
Yeah.
what
Yeah.
we do. So all we can really do is try and be out there and give that attention to women. At the moment, coming out of lockdown, um, and I know that the Scottish Government have given women's aid groups some extra money or whatever, but that is really just to fight fires at the moment, in my
Yeah.
opinion. It's
Yeah.
not a big cash injection of here we go. We do need more funding for specialised women groups like Amina, like
Yeah.
that are really, really good at supporting women, but specialist women's groups like Amina and Shakti Women's Aid, etc., that are dealing with more specialised groups.
Mm-hmm.
Sometimes what I find is that can be a lot more time intensive.
Yeah.
So you kind of need that bit more work. Um, the other thing is, Caroline, what I'm finding a lot is women who are coming to Amina are coming with a lot more complex support needs.
Absolutely. Yeah.
We've seen that in women's aid also.
Yeah.
But we've certainly seen that, and I'm pretty sure that all women's aid groups have said the same thing, that women are coming
Yeah.
through. It's not just domestic abuse, it's mental
Yeah.
health, it's
Yeah.
trauma, it's
Yeah.
everything. How does one worker deal
Yeah.
with that?
And that's why it's so important, but for collaboration and partnership working and multi-agency working, absolutely. Can you tell us, Mariam, about the work that you're doing at the moment, that obviously supporting and raising the awareness around domestic abuse?
Absolutely. So, obviously, what one thing that I would say is that with Amna, we've got a helpline, right? What did we see during our helpline? During lockdown, we had probably about 75% of all calls that came in to our helpline were related to domestic abuse, right? So that's over 1,000 calls within a year, but you're talking about over 1,000 calls from women from predominantly BME communities, and all of them had additional barriers: no recourse to public funds, language issues, immigration issues, not understanding their rights, a lot of harmful traditional practices. So the kind of impact even on AMNA has been quite significant. You know, workers have felt that burnout as well, like as in we're really wanting to help women, but how do we do that when we've got one woman who's came to us and we've had so many things going on here, right? So really, to be honest, trying to support one woman, which is what we want to do, but there's so many different issues. Where do we start? So money is an issue, immigration's an issue, housing's an issue, safety is an issue, risk assessment, safety planning, all those kind of things become an issue. So on average, we were dealing with like 3 women, and we still are 3 women a day when it experiencing domestic abuse. But also we do a lot of campaign work, right? So in general, even before lockdown, AMNA's been quite good at kind of highlighting the kind of issues that are specifically affecting BME women. So we did the kind of What's My Crime campaign, and that was really about kind of women blaming, right? It's always like the women's fault about, is it my crime, that is it my fault? So it's all like, well, she must have done this, or she must have been a bit mouthy and she's a bit too westernized. It's a thing that a lot of BME women hear. Oh, she's a bit too westernized, she's a bit too this, she's a bit too that, and maybe the next time he goes off, you should calm down. You're kind of aggravating the situation. So we did a video called What's My Crime, and it was all about talking about victim blaming. We've also done like a lot of like campaign work with a lot of Muslim women and BME women. We did a short video regarding street harassment. And it's quite interesting that I'm talking about that right now, especially Caroline. I don't know if you've seen on the internet, it's everywhere, about the Olympics volleyball team not their shorts, right? So they're not. But then at the same time, you found that the EU were talking about how Muslim women can't wear the hijab. Maybe in some workplaces it's okay to tell them not to. So we've still got that kind of patriarchal society.
Yeah, absolutely.
And BME women and non-BME women, we're still dealing with it. So whether it's about Muslim women wearing the hijab or women just in general wanting to wear a different piece of clothing, our outfit by society is still pretty much controlled. But what we found was that we did this little video, and it was about kind of highlighting through posters and video that, you can have a hijab on and you can have a short dress on. That doesn't mean that, you're more likely to be sexually harassed. So a lot of people think, oh, because I've got a hijab on or I'm dressed really modest, that I'm completely free from sexual harassment.
Yeah,
you're right, and we know that that's completely false. But then there's also that notion of a lot of maybe men in communities would think, oh, she's got a dress on, she's got a wee short skirt on or whatever, so she's asking for it. And we all know that that's complete garbage. So, really it's about letting women know that street harassment, sexual harassment, regardless of what you're wearing, what you're doing, is going to happen, right? It's going to happen regardless. And I think a lot of what we deal with in AMINA is that notion of, that stranger danger. So it's like, oh, you're only going to get sexually harassed or abused if you look a certain way, or it'll be dangerous. We don't realise that actually majority of the perpetrators are perpetrators that regardless of what you're wearing. So those are the kind of campaigns that we do. During lockdown, Caroline, we had to kind of get a lot of, and I'm sure this was the same with Women's Aid, digital devices, so like smartphones and iPads, not iPads, sorry, maybe not iPads, what are they called? Tablets, not iPads. I wish we had that kind of level of funding to provide iPads for everyone. We don't. It was smartphones and tablets, right? But because we were talking earlier about the barriers. How do we connect with women in lockdown if they don't have digital connectivity? So if they don't have good internet, if they don't have internet at all. That's one of my biggest bugbears, by the way, just off topic about homeless accommodation out with local authorities, is that when women initially do flee domestic abuse, they don't have any internet. And a lot of watching right now might think, why is that even important? Well, if you're fleeing with children, right, a lot of schoolwork was done online, right? when schoolwork was done online, your work was online. Um, you know, and if you wanted to just phone me on a WhatsApp call or whatever, you needed internet for that as well. So if you're kind of fleeing, how do you think it's going to be for children? What are they going to say? Why are we here? What are we doing? So really, to be honest, the importance of Wi-Fi and good connection, I don't know if you found that, Caroline. How important was that?
Yeah, no, absolutely. And we've thankfully got some funding to be able, same as you, to be able to provide, tablet, phone, Wi-Fi, and things like that for women. But yeah, no, absolutely. And again, it's another barrier, not just for the women, but for the children and young people as well. The experience that they're going through, is traumatic enough, but then to be faced with that as well, absolutely.
Yeah.
They can. Sorry,
No,
you go.
what I was going to say was look at the impact on, and if anyone who's watching this, they probably didn't realise that initially when lockdown happened, women who were dealing, or workers that were dealing with domestic abuse, we weren't classed as essential workers straight away.
Yeah,
So it was
not
that.
straight away.
And we weren't classed as essential workers, right? But I know from my experience that when we've got a woman who's fleeing, if she's going into a local authority, one of the things that I used to be notorious for was my Lidl shop, which was, right, you go into homeless accommodation and I'll go run to Lidl and get you what you need, which is your eggs and your milk and your ketchup, salt,
Yeah.
toast, like bread, everything that you need. So especially if you're with younger children, you've been located into an area that you're completely unfamiliar with. I'll
Yeah.
get, at least you've got some basic food. So you've got some underwear, you've got some clothes, you've got a lot of women just leave in the clothes that they've got. And
Yeah.
women rely on services like Amina and Glasgow Women's Aid and workers that work in our organisations to see women and say, right, I think this is what she needs. Let's go get da 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 da.
Yeah.
That that service, I think, fell by the wayside for everyone in Scotland, because the initial lockdown was really difficult.
Yeah.
And you were really relying on social workers to step up and say, right, okay, but a lot of social workers were like, well, here's just some money. So
Mhm.
you couldn't go in to do your pre-mark shop for women, and that used to save us money, because it's
Yeah.
we don't get a lot of money to go get clothes and toiletries and whatever.
Mhm.
And that's the one thing that Amina, we had to do as well. We did these Amina care packages,
Right.
had everything in them, like toiletries, hand sanitizers, sanitary towels, your basic stuff that women need.
Yeah. Yeah.
It's interesting, even when women leave, there's so many times, that I used to say, do you have any sanitary towels? Do you need them? Is it your
Yeah.
while you've just left? It was almost like the last thing on somebody's mind, when they've
Yeah.
just left. But how do we, how do organisations mitigate the kind of risk that women are at? So we know that women are at the highest point of risk. So you're more likely to be seriously harmed or murdered when you're leaving. So
Yeah.
all women's aid groups, and I'm sure that this is the same, and even with Amna, when we were trying to get women to leave in an abusive relationship, that risk factor was still there. But how
Yeah.
to do that safely, and how did it was that challenge of doing that safely with everything closed, because the excuses that women would normally use to leave the house,
Mm-hmm.
right? How do women just leave the house with any of their belongings when the perpetrator is there every day? It was absolutely impossible. We had a lot of women during lockdown that just left with the clothes on their back.
Mm-hmm.
And usually what you'll find is that women do get a bit of chance to do a bit of planning, like get a few clothes together, get a wee bag together. Um,
As I was going to say, Mariam, do you want to say a bit about that, like about safety planning, and what
yeah,
would you say to a woman, so whether they're still in the relationship, obviously doing a safety plan, or the process of her leaving, what would you say to women, and advise women at
yeah.
that point?
So at the moment, what I would say is, okay, so see before lockdown, right, where was your roots out to get out, right? So if you're with an abusive relationship, you would go to your doctors, right, or something. You would tell your doctor, look, this is what's going on. But a lot of women, when they go to the doctors, they won't phone up the doctor and say, hi, what's your issue? Oh, I'm experiencing domestic abuse. Yeah, come in. Normally it would be, oh, I've got headaches, I'm not sleeping, I've got depression,
Yeah.
whatever. And what you would hope is that the doctor would say, okay, well, what's going on? Why are you not sleeping or whatever? Well, this is the kind of situation I'm in. And we've had so many healthcare professionals that have said, okay, you can go to Glasgow Women's Aid, you can go to Amina, you can do this, you can do that. The problem with lockdown, Caroline, was that it was all, is it your triage calls, I think it was called, which was phone us, let us know what's going on, and then we'll give you a call back, right?
Yeah.
So
Mhm.
if you were a woman and you were trying to safety plan and you knew that all your movements were being controlled, the one thing that you could go to was your doctors, but that
Yeah.
use had kind of gone out the window, right?
Yeah.
Health visitors were coming to the house, but we know that a lot of health visitors sometimes use coming to the clinic as an excuse for like baby weigh-ins or something like that. Like, oh, come in, we'll weigh the baby, or your immunisations or whatever. All that had gone as well. So there was a lot of routes to get out of the house, just to take the first step out the house, had
Yeah.
become possible. And I think they still are, especially if we're thinking about a lot of BME women that maybe stay with extended families. Um, how do you still get out? How do you still use that excuse if your brother-in-law and your sister-in-law and your mother-in-law and your husband, they're all working from home? So
Yeah.
one thing that I definitely did see was a decrease in women fleeing domestic abuse who stayed with extended families.
Right.
Right.
Okay.
And I've still said that look, there's definitely been an impact of women who stay with extended families if you think about the number of members that are in the house. But what can women do right now? And again, we've got the National Domestic Abuse Helpline. We've got the
Yeah.
line that you can call. You've got the National Domestic Abuse Helpline. So those are the kind of helpline numbers that you've got. Also, I don't know if you know about the service, and I'm sure is it a lot of the boot services that Ask Annie,
Yeah.
or is it
Yeah.
for Annie, right, or something like that? So you can ask for Annie, and it just means that they can actually give you like a separate room where you can make a domestic abuse call, and that's really, really important for us to kind of utilize something like that. Simply because we know that now shops have actually opened up again.
Yeah.
And go into Boots, and Boots was actually open all the way along. Um,
Yeah.
Lockdown, so you were hoping that women would do something like that. But see, at the moment, I would say, Caroline, just coming out of lockdown and we're still in lockdown, you would say to yourself, what's the aim of this campaign? And it's to show that, look, we've had lockdown going on for over a year now, right? For over a year, we've got women in the most horrific situations, and they've had to see so many slogans about safe at home. Stay home, stay safe, stay home, stay safe. And actually, their home was not a safe place to be.
Yeah.
And if you talk about women being confined to with the abuser, staying with the perpetrator, think about what lockdown would have been like being with the perpetrator 24/7. So for me, it's about, we're moving on from that, but services are completely stretched, right? Amna's completely stretched, Glasgow Women's Aid is pretty stretched. I'm sure of that as well. Am I right, Caroline?
Absolutely.
We could
What I was going to say, Mariam, is so people that are watching, and we've got, hi everybody, and thanks everyone for joining us. Great support. What can people do to support Amina? Is there anything, whether that's fundraising or anything like that? What kind
never.
of support can
Honestly,
people?
I would say that if anything, like if anyone does ever do it, and it's the same like Glasgow Women's Aid, if anyone does contribute towards AMNA or do any fundraising for AMNA, any money that we normally get within AMNA is used for something like our hardship fund. So
Right.
something that we've actually got in AMNA is a hardship fund, and it's something that we've had to use quite a lot. So we'll get a lot of women that come with no recourse to public funds, and unfortunately, as much as they might get housing, they don't really get anything else. So there's a few situations where the council will actually pay if she's got children for the kids, but not for her,
Yeah.
because she's got the no recourse to public funds, but the kids don't. So you'll
Yeah.
get, but it's only towards you. So it's again going back to that, like when the weather changes is when I always find the biggest impact. So, it's suddenly become hot, right? So she's wearing trainers or she's got boots, you know,
Yeah.
big
Yeah.
boots and a big jacket. She doesn't have any summer clothes, or she doesn't have anything that's suitable to wear for when the weather changes, especially when the rainy season hits. It's interesting that, Caroline, because see, sometimes when the rainy season used to hit, you used to see some women coming in with flip-flops on. You used to be like, why are you wearing that? Like, have you got
Yeah.
shoes? So if there is anyone that wants to support Amna, any money that we get goes usually towards our hardship fund. Used for women, so it'll be clothes, it'll be toiletries, it'll be, food, a mobile phone. We had to get women a mobile phone once with like some internet, and I remember she asked, look, can I get a phone or whatever, but then it's like, well, there's no point just giving a phone. Do you have internet? Do you have contacting us? So those are the kind of things that if you wanted to support Amna, that we would use for. And again, I would say that, you asked, how can you support BME women? Again, I think it's just about understanding that every woman has a really difficult journey to try and leave, and there are those additional barriers. And I think just understanding those barriers and understanding that, you could be supporting a woman and you could be helping her, and you've done everything that you can. You phoned Glasgow Women's Aid, you phoned Amna, you've done everything, but yet she still has not left. So it might be that she still doesn't feel like it's safe to leave, or we've had maybe a lot of people supporting women who are asylum seekers, and their path to safety is horrific. There's no other way of saying it. If you are a woman and you have got an asylum claim, and maybe your asylum claim is based on your husband or your partner, and now you want to leave, and I mean, the amount of paperwork and the amount of uncertainty that women would need to go through is horrific. It's not all easy to just say, get up and leave or whatever. But the best thing that you can do is give her the helpline numbers, believe and validate her story. Like, don't question it, believe it, validate our story, understand that it's difficult, but also understand the mental health impact of domestic abuse. And Caroline, see, coming out of lockdown, I think that's the one thing that every single service is worried about, is how are we going to find the capacity and the right level of support to give women with the amount of mental health issues that they've had with experiencing lockdown. And Caroline, even without lockdown, think about everyone, all of us, how much lockdown affected so many people, have gone into depression, isolation, right? And even now they're finding trying to get back to this normal life really difficult. But imagine women who've also experiencing and still experiencing abuse. See the impact on them and the trauma on them. Trying to really understand that trauma going forward, but making sure that it's not just a case of, right, get the women out that situation. We know that even if you end up in refuge, you'll still have depression, you'll still have trauma, you still have issues. We need to find the right level of services to give women that level of support that they need for their mental health issues as well.
Absolutely. Thank you so much, Mariam. Thank you and Amina are on Twitter, Instagram and Facebook as well. Amina MWRC, so anybody who's joined us, follow Amina as well, and hopefully everyone stays tuned to our campaign all week. We will be sharing, everything will be on our social media. If anybody wants to get in touch with Mariam or anyone at Amina and any support that they're looking for, you'll find all the details and everything on our social media and on our pages. But thank you so much, and it's, this campaign is so important, of raising this awareness and everything that you spoke about. I think it's been amazing to highlight the barriers. I think people forget about the barriers that women are faced with, and it's not just easy just to get up and leave. So thank you so much for highlighting that and joining us, and I'm looking forward to us doing training together as well. We're going to join up and do some.
I'm looking forward to that. I think just about the barriers again, those barriers were always there. Lockdown just made it 1,000 times worse, right? For every a big barrier. So it's kind of that thing about, how do you come out that situation? How do you keep women safe? And I think Glasgow Women's Aid Amina, that's been our main aim. How do we support women? How do we keep them safe? How do we
Yeah.
keep them in a place, and women and children in a place of safety, but with all these barriers and lockdown as well? And it's been a challenge for all of us. But yeah, the resilience for women as well, but we want to hear women's voices as well and make sure that going forward, that I think we've still got a lot more understanding to do and see these kind of campaigns, I think is the first step now that we're still in lockdown, but it's not over. And even
Yeah.
to come out of lockdown, the impact of this lockdown, I think, is still yet to be fully understood. And that's why Glasgow Women's Aid doing these kind of campaigns are so important, just to show the level of impact that women have had with domestic abuse, but on services as well, on workers, services, that burnout that we're all feeling as well, with lockdown and supporting women. But our
Yeah.
mission women safe. So yeah, these campaigns are going to hopefully help highlight that continuing support that women still need to be safe in society.
Thank you so much, Mariam. Thank you. And there may be any questions that are coming in after. Martha, our comms worker, will respond to them, or anything that comes thereafter. But thank you so much, and please stay tuned into Still in Lockdown Week campaign on all our social media streams. But thank you, Mariam. Thank you so much.
Thank you everyone for joining. Thank you. Bye-bye.
Thank you. Take care.
Bye.
Bye.